All right, welcome back to Cusp of Coffee. I'm Jan Klerk, a final year dental student.
And I'm Mr. Cusp, aka Uwais Adam, a third year dental student.
And welcome back to another week. So, this week was first week back for both of us from recess.
Yeah.
And yeah, I feel like on this end, it was very much just like hitting the ground running. On Monday morning, I got in and I was working in the sort of emergency department of our prosto ward, which means anything from like people wanting knee dentures to ill-fitting dentures or basically any denture related problem. People would just like kind of walk in. It's like a walk-in clinic. And I was booked there from like 7:30 to 11:30. So it's 4 hours of just like seeing patients the whole time. And the moment you finish with one, there's already like two outside waiting to get in. So it's just like I'm barely back, and already it's just like this conveyor belt of patients.
Oh, so it's not like you're seeing your patient. It's like you're seeing a patient and you don't see them again necessarily.
Yeah.
Oh, okay.
Yeah, you'll put them on a waiting list, or you'll take like an impression for them, send it off to the lab that they can collect at a later date.
Oh, okay.
So you're just kind of like doing whatever needs doing when you're on emergency. And yeah, then immediately after that, I had to go to the lab because I had Crown and Bridge the next day. And it didn't really register up until Monday that I had Crown and Bridge on Tuesday. And then I realized, there's like a bunch of lab work that is not ready for my patient. So I was sitting there sweating, and like right until the lab closed, I was still busy. So
What
Monday
lab
was
work do
just
you
like,
need to do though for like that?
you need to make like special trays. You need to make wax ups of the teeth that you want to, put crowns on.
Oh,
so that
okay.
you can make like a temporary crown for them. After
Yes.
you've prepped and stuff. So yeah, on Monday it was just like, oh, okay, we're back.
Yeah, so they really make you do all the lab work, like every single aspect of it.
Yeah, pretty much.
Because you see, by us,
that's one
like
thing I'm very excited for, is to not
not
do
do
that again.
yeah. Because you see, by us, like we have to do all the lab work, but when you get to like final year, you don't touch lab work anymore. Like the lab at campus does basically all the lab work for you. Like there's small things
Yo,
you have to
must be
do,
nice.
but they do everything. But then again, that's also like it also will make you, I feel, better, like adapted to deal with things, especially in pros, because you've been doing all the lab work even more than someone like maybe I will have done.
Yeah, I mean, it comes up in Rempros, I would say. Like if you send something to the lab and they send it back and it's not correct,
Yeah,
then at least you can just fix it there.
Yeah.
You can just do it yourself. So, but yeah, it's a lot of time that, you could kind of be doing other stuff.
Yeah.
And sometimes it feels like a bit of a drag. So, yeah, I am very much looking forward to not doing lab work anymore. But yeah, how was the return back for you?
Yeah, I don't like you said like after being on recess for a while and you just hit the ground running. I didn't realize like how just a short little holiday. I mean, for both of us, it was like maybe 2 weeks or 3 weeks. I don't know how such a short holiday can throw you out of the rhythm completely, but it really did. And I started back, and we started with block weeks, and so we have 2 weeks of block for oral surgery, and then another week for ortho. And so I started with the oral surgery block, and so it's like we starting after 2 weeks, thrown out of the rhythm of things, and immediately back in with a brand new clinic that we've never been in before, new skills to learn, new lecture content to cover. And so I was excited for it because I've always wanted to do oral surgery. I've always liked, the idea. Everyone wants to be a max fac at one stage in their life at least. And so it's like, those are generally the coolest guys walking around the hospital. Some of the people with the biggest, like we spoke about last time, the biggest egos. And you just like, they just exude this confidence, and you're like, this is like the coolest clinic to be in. And then once I got into that clinic, and so we were paired up with there was like, we were there for 2 slots, so 4 hours. The first slot we were paired up with oral hygiene students, and they needed to practice their injection, so we needed to kind of help them with that. So half the session you're playing mentor, and then second half of the session you're like just struggling because you need to extract a tooth now.
Yeah.
And it is so much harder than I realized or that I anticipated. And all of the things we spoke about in the last episode about just being like, not like giving yourself time to figure out something, or like putting in the extra time, it all like came cascading back into my life, because I haven't felt that for a while, you know. Like the first time I really felt that was the start of the year in pros, like we spoke about. But I kind of got a bit more used to pros, and I was kind of in a good rhythm, and everything's out the window now because oral surgery was like kicking my ass this week. Like crowns were breaking, the roots were getting stuck. I just basically, without any experience, I couldn't get anything out. And so still after an entire week, I still haven't pulled out one full tooth on my own. And so when you see these final year students or the supervisors come in and get it out in like 10 seconds, and you've been sickling and you just can't do it, it just gives you those feelings, you know, those feelings of I'm inadequate, I can't do it. And it's really difficult to reframe your mind and be like, it's the first time I'm doing this, I need to give myself time. You know what I'm saying? Like, so there was a lot of those feelings of being inadequate, or feelings of just feeling like this is not for me. You know, it's very difficult to actually be like, I will get good at this, because the whole time your brain is just telling you like, oh, you're never doing oral surgery, this is not for you, just leave it, you know?
Yeah.
Whereas I haven't even gotten to the point where I'm comfortable with it yet. So, yeah.
Yeah, I feel like oral surgery is a big adjustment. Like even for me, I would say it's the one clinic that still really stresses me out, and that I don't have that like massive confidence yet. And also when I started, for the longest time, I was also like, but how do I get the tooth out?
Yeah,
like,
exactly.
like how does pressing on the tooth make it loose and then it comes out at some point? Like it just, like my brain was like, how? But it is like a time thing. And even this year, so I think I spoke about this before to you at some point, but how it works with us is you have different metrics with your extractions. So they measure like the difficulty of the extraction, but they also measure things like how independently you were working, and that kind of stuff.
Yeah.
And at the start of the year, I kept like having to ask for help basically to like get the teeth out, mostly because, you know, it was after like vacation and everything.
Yeah.
So I just didn't have that like rhythm anymore. And at the start of the year, I kept having to ask for help, which was a big problem because for us to graduate, you need to have a 90% independence ratio, and you need to extract at least 50 teeth, which means if you do the math, you can only ask for help 5 times.
Oh, damn.
Before you drop below the threshold.
So if you don't get
So,
90% for that thing, they like, will they seriously like not let you pass?
No, so the only way to get back to 90 is to extract more teeth, but then obviously you can't like afford to ask for help then. So basically after you've asked for help 5 times, anytime after that you have to ask for help, it's basically an extra 10 extractions you need to do.
Damn.
To make the math work.
And
so,
if you get to the end of the year and you don't have the 90%, what happens?
I mean, then you come back next year.
Really? So they'll actually fail you on
fail,
that?
Yeah.
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 Okay.
So I mean, like last year there were people that did over 100 extractions just to get that independence ratio back.
Yeah.
So, yeah. But then, like, I don't know what happened. There was just one week where I came back, I booked like a bunch of extra sessions, and I was just like, okay, I've made all my mistakes, I've learned from them, like, let's just go for it. And then from there, like, I haven't had to ask for help again. And in the meantime, we also went on the pillow paper train.
Yes.
Where we did like, I did more extractions there than I did in extractions at my hospital. So coming back from that, I was also like, oh, okay, like I have much more confidence, but the only reason I have that confidence is just I've extracted a lot more teeth.
Yeah.
So it's purely just like
Practice.
It's once again that thing of like, it's a wall. You just gotta keep bashing your head against it. At some point it will crack, but until then it's not the most fun experience.
Yeah.
But yeah, you just kind of gotta keep your head down and just try to keep moving forward.
Yeah, and that thing you said now actually made me think how you told yourself, like, okay, I've made the mistakes, we need to just do it. And that's something I've actually, like, as you said that, I'm realizing that's something that you have to do a lot, especially like in dental school. Obviously, you can apply it to life as well, but it comes a lot in dental school because there's multiple times where I've had to do that, where, whether you're somebody who complains a lot in life or somebody who doesn't complain a lot, you get to a point where everything is going wrong and you need to just essentially decide, am I going to keep complaining about it? Am I going to keep stressing and telling everybody how it's the worst thing ever, how I hate it and it's just a bad, horrible? Or are you going to have that moment where you just pull yourself apart, like pull yourself away from everything, like dissect the problem, pull it apart and be like, okay, I need to just do it now. Like, I need to just do it. Like, it's a weird moment because it's like sometimes the mountain ahead of you for the task you need to do is just like so humongous and you feel so overwhelmed, but you just need to do it. And the stress comes from different aspects because you have a patient sitting there sometimes, whether it's like work you need to study at home and you're like, I just need to do it. But it can be more stressful when there's a patient there and there's a long procedure you need to do and you feel like you don't have time and there's a supervisor breathing down your neck and you're just like, what do I do now? You just need to tell yourself like, okay, I know I need to just figure out what I'm doing and I need to just do it. Like, it needs to get done. If it's not going to get done, no one else is going to do it. So it's on me. And that can cause a lot of pressure sometimes. And a lot of stress, but it's something I think you need to get used to. I haven't fully gotten used to it yet, but yeah, I feel like it's essential.
But also, like, the thing to keep in mind is, for example, oral surgery. This is literally the first time in your life.
Yeah, exactly.
Like you as a human being, the first time like that you are alive, that you are doing something like this. So if you were good at it right from the start, that would actually be very weird. Like, it wouldn't make sense.
Yeah.
But like, that's kind of the pressure we put on ourselves. But it doesn't make any sense. Like, logically speaking, any skill, and extractions is very much like, it's a hard skill to learn. And like with any skill, you just gotta put in the time and eventually you'll get there.
Yeah.
There's this one line I always think about that I read once, which is that when you're stumbling, there's a point at which one of two things happen. Either you fall down or you learn how to stand back up. And I feel like, whenever you start something new, you're kind of stumbling because, the ground's uneven, you're not sure of your footing. And, you kind of got to make that choice. Am I just going to fall down and like, that's it? Or am I going to try to figure out how to like get back up to like a point at where you were,
Yeah, you know what? Okay, random question. Have you ever been like rollerblading?
No, I've been skateboarding.
Now, if you
but
go
I don't know
like
how that correlates.
Okay, so if you go rollerblading, I went rollerblading recently, and I have no balance. And while I was doing that, I was literally stumbling the entire time, like you're saying. And it's extremely difficult for me to find balance. And the entire time I was comparing it to dental school, because that's just how I am. Because I was thinking to myself, like, there's a 2-hour session of this rollerblading that I need to do. All my friends are doing it really well. And I am falling on my ass every 5 minutes. Falling on my hip, falling on my shoulder, and I'm just losing balance. And I'm thinking to myself, like, I just want to quit. Like, I'd rather want to just go and sit on the sofa and wait for the session to be over. But, and whereas I could have done that there, I kind of forced myself and I was like, I can't do it here because then I'm going to apply that rule to the rest of my life, Like, whereas in school, you can't just do that. You can't just say, okay, I'm not going to do this extraction. I'm just going to go and sit and wait and just hide in the corner. Like, you need to do it. And so You need to force yourself to find that footing. So when you said that, I kind of immediately put myself back in that scenario, because there you literally need to find your footing to actually be able to do the thing. And that sort of applies to the rest as well, because like whether it's figuratively or literally finding your footing, it's like you need to find your footing, especially, and just do it in the clinic as well. And for oral surgery, like it's a skill that you can't learn unless you just do it. Something like restorative, like you've been practicing on dummies and stuff for long, so you kind of have a little bit of confidence because you've been practicing in a low stress environment. Whereas with something like oral surgery, maybe even pros, like there's no real practice on how to take an impression, on how to do jaw edge, on how to take out a tooth. The first time you do it, it's in a high stress environment, so you need to just find your footing, and it's difficult. It's quite difficult.
Yeah, and I feel like on the kind of the topic of finding your footing, so this week the first years are now officially on medical campus. And then on Wednesday we had to go like as a committee just to like greet them, welcome them. And I was kind of standing there looking at the first years, and I was like, yo, they have
a long way to go.
they
They don't
know what's still waiting for them.
They really don't
like
know.
all those phases of like feeling like an idiot, and working your way towards being less of an idiot. Like they have so many iterations of that still to go through. And I was like, you know what, even though I still have a few things I need to figure out before graduation, it like made me appreciate how
far you've come.
sort of how far I've come
Yeah.
since first year, how many times I've stumbled and eventually gotten back up. And in a weird way, I kind of left that session feeling a lot more energized and at peace, because I was like, you know what, I've done this whole stumbling thing and getting back up thing like
So long.
hundreds of times at this point. I can probably do it like 10 more times, which is pretty much all I need like up until the end of the year. And I told you last time, it's weird as a final year, like still coming up against like new challenges for the first time. And this week was actually no exception. So one of the things I had scheduled this week was special care dentistry for like special needs patients. And I've never been in that clinic before. I've never had to work there before. And then on Thursday morning, I had to spend like a full 4 hours there just seeing like all the patients there. And that was definitely an experience. So obviously before that, we had a little bit of like theory training. And I read up a bit more in terms of like Down syndrome, autism, Tourette's, all these conditions that the patients typically present with in special care. But actually being there and interacting with them and, trying to figure out like the best kind of treatment, what can you do in that session, what's maybe a bit too much. That was like a very, I almost want to say it was kind of a tiring process. I didn't expect how much it, would kind of take from me to work in that clinic. And it was very humbling as well, like extremely, extremely humbling. And it kind of put a lot of things back into perspective for me, because obviously on Monday, it's like, sorry, on Monday I came back and then like, pressure's back on you, start stressing about all these different kinds of things. And then when I was working in special care and I was interacting with all those patients, I realized like, there are people out there with like way bigger problems than I have. So it kind of reframed a lot of things for me. And I was like, what, a lot of these things I'm stressing about right now, like it's not actually that bad. And even like later in the day, I ran into Dr. Pereira, which I think most people know who he is at this point. But he's one of the doctors that works in our prostate department, and he also made this comment of like, will this matter in 5 years? And I was like, you know what, like a lot of the things I'm thinking about right now, in 5 years it's going to be completely relevant. So I can afford to just chill out a little bit more, like just know that I'm still going to struggle a bit, but if I figured out all this other stuff, I can probably figure out the upcoming stuff as well. And even by the end of that like special needs session, I actually felt like way more comfortable with like seeing special needs patients. Up until that point, I've never seen any special needs patients. So the idea of seeing one was like completely like
Daunting.
Daunting.
Yeah.
It was so scary. But then after seeing like, I saw 6 patients in that time. After that, I was like, oh, like, like it's not actually that bad. They're
Yeah.
also just people. It's just a different approach, and you have to individualize it a bit. But like, it's still fundamentally the same kind of treatment.
Yeah.
It's just a little bit of a different behavior management and taking the patient more into consideration.
Than you
as
usually
opposed to
do,
maybe
yeah.
somewhere else. Yeah.
Yeah.
Like for example, something like a polish, right? That's like a low stress procedure.
Yeah.
Like you don't really think about it much.
Yeah.
But then for my one patient, he had Asperger's, and so he had like very heightened senses. And so for that patient, doing like a polish was actually like this big thing, because it's sound and it's vibration and it's just a lot. So for that patient, I kind of had to manage it a bit differently. So what I ended up doing is I basically just kind of counted to 10, and I'll tell the patient every time, okay, the moment I get to 10, then we're going to stop, we're going to take a little break, we're going to chill out. And so I would then start polishing, and then I would basically have 10 seconds to polish the whole quadrant.
Yeah.
So I would be like, it was kind of funny. I would get to like 8, and then I would be like, up until that point, I would count normally, and then it'd be like 8, 9. But it's just...
It's the things you have to do, yeah.
Yeah, but ultimately it's still the same treatment. It was just a bit of a different approach.
Yeah.
And once again, I was like, I felt nervous, but then I did the thing. And then another thing that I always try to remind myself whenever I'm doing something new, especially in dentistry, is like, what's the worst that could happen, And most of the time, it's not as bad as, or well, can I say the severity of what could go wrong doesn't correlate well with like the amount of anxiety I'm feeling, Like for example, like when I was doing basic restorative for the first time and I had to do my first ever class 4, I was like stressing so much because I was like, oh, it's in the aesthetic zone and I've never done this before. How to get the incisal edge correct, and like all this different kind of stuff. And then, I was a bit like freaked out. And then even afterwards, I was thinking like, like worst case scenario, you just kind of do it again, or you just recontour it.
Yeah.
Like it's like not a lot can go wrong. For example, with a class 4 restoration. Obviously, something like extraction is a bit of a different scenario.
Yeah, a bit more high stress.
Complications can be a bit more high stakes, but there's actually a lot of things in dentistry where it's not actually that bad. Like for impressions as well.
Yeah.
I had to take impressions again yesterday, and part of me was like stressing a little bit because I haven't taken impressions in a hot minute. And then I was like, Johan, you're being stupid. If it comes out bad,
Just take it again.
just take it again. Like that's it. Like no one dies, like
Yeah.
you don't get shouted at. They're just gonna tell you to take it again. So I was like,
Yeah.
oh, okay, never mind.
Well, before you even show it to them, you just take it again. They don't even know you took it again. Like, it's like the stress is. We will put a lot of stress on ourselves, I feel, and I feel like the pressure builds because, especially now, like, because we've spoken about this so much, and because I know that my hands can't do these things, and I need to give myself time, I kind of get in a rush in my head. I'm kind of just like eager to get to the point where it's normal. But you can't be like I have to remind myself that I can't be too in a rush to get to that point because it takes time to get to that point. And that becomes frustrating. But ultimately, like, I think shutting down comparisons, like not comparing yourself, because a lot of people, came into the clinic and all their cases were like extremely easy cases. Like all of my cases were like, very brittle crowns. They're all smokers. The teeth were all like, like, what's called it, like ankylosed into the sockets. Like it was just difficult cases. Whereas a lot of other people maybe had easier cases and all those teeth just popped out. And while that did a lot to build their confidence, it kind of like pushed mine down a lot because I was like doing the thing again where you compare yourself, even though you just can't. Like, you can't compare yourself. And so
Yeah.
I think it's about reframing your mindset and just realizing that it's going to take time. Even though you know it's going to take time, you need to remind yourself, yes, it's still going to take time, even though I know that, you know?
Yeah.
Like, yeah, that's ultimately what it is. And it applies to any clinic. I'm just feeling it a lot more now because I've started brand new, in a brand new environment, you know, new clinic, new skills to learn. And yeah, it's just brand new stuff.
Yeah. Yeah, and I feel like what also helps a lot is just keeping a bit of perspective. So I mean, if, for example, you're in third year now, but we only start seeing patients in fourth year,
Yeah.
which obviously we've spoken about before. But like, for example, if you take something like pros or restorative, if you were to compare yourself versus like the third year version of me, you're like light years ahead of me.
Yeah.
Like, yeah, so far ahead of me. Which obviously, you know, like our dynamic is obviously a bit different because I'm now final year, you're third year. So it's, you know, it's easier to feel like you're like the inexperienced one. But if you keep perspective, then it's like, actually you're in a very good place clinically, you know, compared to like, for example, a lot of other students around the country who haven't even touched a patient yet.
Yeah.
You know?
That's true.
And that's kind of like the bit of the, I would say, like unfair advantage you have at UWC is that you get to see patients so much earlier. So you have a lot more time to do that adjustment, which is actually like a very, very nice thing. So even though it sucks now, in the grand scheme of things, you're kind of getting this out of the way early.
Yeah.
Like, third year version of me, you're rough. Like he still has 8 months to go before he starts getting like, you know, beaten down by oral surgery.
Damn.
So I think a lot of it is just like, just trying to keep that perspective, even though in the moment it sucks.
Yeah.
It's just like, do everything you can to remind yourself that like, okay, this is okay, this is normal.
Yeah. And just like make the mistakes, you know, especially in a very safe environment, because I've seen, you know, the supervisors are very, very like, they're very cautious, obviously, with us, way more in oral surgery than any other clinic, especially because we knew. They don't let us touch elevators. They don't let us do anything. Like, they're very, very cautious with us. And I think that's all because of like, you know, we're going to make the mistakes. So make them now. So that when you get to final year, or even, you know, fourth year, like, you're a lot more confident. And when you graduate, you've made all the mistakes in the safe environment, you know, basically what we spoke about last time again. So, yeah, I think it's about reframing the mindset more than anything else.
Yeah. And then on the topic of mistakes, just like one story I just wanted to tell from this week. So on Tuesday, ended up seeing that Crown and Bridge patient that I did the panic lab work for.
Panic lab work.
And then in that session, I had kind of mentally prepared myself to start doing a post-on-call for this patient. And then my supervisor was like, no, start with the crown prep and then do the post-on-call. So I was like, okay, bit of a panic because I hadn't prepared myself to do a crown prep.
Yeah.
So I like, so what I did is I had like a second year assistant there.
Yeah.
And I took out my notes just to show the assistant what we were going to do. And as I was doing that, I was just like rechecking the margins I needed to get for the crown prep. And I start prepping. I'm like doing my thing. And at first I'm a bit nervous because I haven't done crown preps in a while. But then eventually like this thing starts coming together. I'm like, oh. And like I realized that like all this studying and all this stressing about crown and bridge, because it's been in the back of my mind for so long, like I started remembering a lot of things that I had seen at like the private practices I shadowed at. And I remembered like small things they did to improve their preps.
Yeah.
And I just start trying to implement it. And like, I think just because I've been working with my hands for so long now, it was one of the first times where I tried something for the first time and my hands did exactly what was in my head. And that was like, it was such a big like full circle moment for me, because all these years, you know, it's been that process of struggling at the start, and for the most part it's been, you know, I just can't get my hands to do what I want them to do. But there I was like kind of experimenting with things I'd never tried before, and it was just working. And this crown prep at the end like was like proper. I looked at it and I was like, yo, I did that. Oh my goodness. Yeah, like I felt so chuffed with myself.
Yeah.
But then, you know, as dental school goes, so immediately after I got very humbled because I made like now a temp crown for this patient, right?
Yeah.
Putting this thing on, it's too high. It's too high, too high, too high. Like, it's like almost half an hour that I'm just working on this temp crown. Eventually, I mix some poly F, put it in, send the patient home. And I'm like, okay, good. I got there in the end, right?
Yeah.
I put the temp crown in at about 11:30. At around about 2 o'clock, I get a message saying the temp crown fell out. And I just get the message after all that sweating. And the patient sent me a photo as well, just like the cracked crown.
Oh,
I'm like, all
goodness.
that effort to make this nice temp crown just out the window.
Gone.
You know? I'm like, you know.
Did
at
they say
least
what?
The prep was nice,
Did
but
they
like,
say how it fell out or what happened?
it broke and then the pieces fell out.
They were biting something and it broke.
I assume so. All I know is like the
It
crown
broke.
was out, and I was just like, okay, it's fine. But then, yeah. So it's like, you know, it was just like that whole day, that whole like before and after the session was just a typical like ups and downs of dentistry.
Literally.
You know? Like when I got the message, I just started laughing because I was like, oh, of course.
Of course.
Of course. It couldn't. No, this day was going way too well. I should have expected. Actually,
Always.
it's my fault for not expecting it.
Always
you know?
something will just come out of
Yo.
nowhere and humble you. No matter how high up you
Yeah.
think you are, you'll get knocked down.
And it was funny because then the patient was like, okay, so what do I do now? So I was like, yo, I don't know. They're not supposed to fall out. And I was just like, okay. Just like if it gets sensitive, just put on like some Sensodyne toothpaste and I'll see you on Monday.
Make your own
know?
temp crown out of Sensodyne. Just do it.
Yeah. Luckily, the patient didn't have any issues because the RCT was already completed.
Yeah.
So
Okay,
there's
yeah,
not
so they won't-
any
yeah.
vitality on the tooth anyway. So, and luckily, like the prep was nice, so there wasn't like any sharp margins or anything. So it wasn't hurting the patient's tongue either. So, luckily, like it's fine. When I see the patient again this week,
Yeah.
then obviously I'll just correct the problem. I'll do the post on call, and then once that is all done, that's actually a massive check mark. And like another big piece of my quota that is done. And I kind of feel like with this case, I've been sitting with this case for quite a while actually, because I had to do a lot of the endodontic work and stuff as well on this patient. So I feel like when I finish this patient, the day I cement that crown, it's going to be like this massive weight off my shoulders, because then I know I've actually covered most of my crown and bridge quota. And then there's only a few more things to wrap up. So yeah, so I'm just kind of going through the motions, but I'm like, okay, it's fine. Just keep going. Because
Yeah.
I know in the back of my mind, the moment I'm done with this patient, like, then like
You far along.
the reality of actually graduating this year is going to be very,
Very real.
yeah, it's going to become very real. And then also yesterday, Friday, we got our marks back for the prosthodontic test we wrote right before, literally the day recess started. We wrote prosto, and a lot of it was like crown and bridge stuff. And I remember being like so scared for that test, just because I had never written on crown and bridge before. And I was studying some of the things, and I was like, yo, this is a little bit high level, but I have to figure this out, you know?
Yeah.
And like a lot of the material science and stuff, I was like, you're rough. Like,
Heavy, yeah.
I guess I need to know it, you know, if I want to do crown and bridge properly. And then got back at the start of the week and they were like, yeah, prosto marks are coming out on Friday. Just to let you guys know, half of the class failed. And I was like, oh no.
Oh no.
You know, like I'm already kind of scared of the clinical component of Crown and Bridge.
Not the theory
And now
also.
I might have to worry about the theory as well. But then got that, and I was stressing about this like throughout the week. But then yesterday morning, we wrote a test, and immediately after we had test feedback for prosto, I walk in ready to like, you know, fail. Like I was just ready for like 30%. And I get it. Turns out I'm actually promoting prosto at this point.
Oh, damn.
Like if I just get the same mark again for the next test, I literally don't have to go write the exam. And again, I was just like, yo, Crown and Bridge, man, emotional roller coaster this
Damn.
week. Like, it's just up and down and up and down. But I guess that kind of like, it adds to the adventure of everything. Because
Yeah.
even afterwards, I was like, you know what? I kind of prefer the up and down week as opposed to like just a boring week where everything was calm.
Yeah.
Because when you have those wins, like when that, you know, when that crown prep was coming together, or when I saw my mark, like it's such a rush,
Yeah.
you know, like it's this mix of release of like a relief and joy and like adrenaline. And it's just like, yeah, you know,
It's an amazing feeling, yeah.
let's go, you know. So
Especially because you know how
Yeah.
much work it took to get to that point.
yeah.
Yeah.
So yeah, another week in, another part of the journey. I think
More
that's
ups
pretty
and
much all
downs.
from my side.
Yeah. No, that's basically it from my side as well. Like, it's just, you know, the episode 1 was titled Ups and Downs, but that can apply to every single week in dental school, clearly.
Yeah. Okay, cool. So it's another week down, another part of the journey down. Good luck for the week ahead, and I'll see you in the next one.